You've got probably 5 to 10% of your members in any, I don't care what size organization, 5 to 10% of them are spending 75 to 80% of the claims dollars. And it's on those high ticket items, right? It's not, and that's the thing I think a lot of times with direct primary care is it's like, well, this isn't really going to save us money. Well, it's probably not, but we're not looking to save money on your wellness visits and stuff. That's kind of dumb. Don't think you're going to save all this money there. It's on these, as you said, it's the MSK, it's the, avoiding surgeries potentially when there's a solution. That's where the savings, the big savings are going to come from, or that. And I would argue drugs, but we won't go there today. That's a different, that's a whole nother, a whole nother topic.
You hit on something that I think is important to talk about as well, for self-funded plans when they're thinking about MSK solutions and what an MSK solution should look like that's going to help the plan curb their costs within that specialty and how to handle that, right? And what you hit on was sort of hinting at surgical avoidance, right? And through potentially physical therapy or potentially a specialty injection or whatever. And I think when I talk to employers, there's a lot of interest in all of those things. And then you have your Regenex and other firms that are working directly with employers to offer non-surgical solutions. And I just want to say that for the specialists that are listening in, particularly the orthopedics, right, this is an opportunity to not feel threatened by these surgical avoidance solutions, but actually to better position yourself as a total MSK solution for employers that you want to direct contract with or work with. Because guess what? As an orthopedic group, you could do physical therapy solutions that could be brick and mortar, could be virtual, could be either, right? And that's still you all as the orthopedic group doing that. And guess what else? As an orthopedic group, you're doing viscosupplementation, you're doing PRP injections and all of these things. And so when I talk to employers, it's like, oh yeah, no, HealthMe's providers, we're doing it all. It's a total MSK cost containment solution. It's an office visit first, and then the doctor is going to determine what's the best treatment plan for that patient. Our CEO says it best, and it's best to come from him, I will say, because he is an orthopedic surgeon. But his opinion is orthopedic surgeons have done themselves a disservice by calling themselves surgeons, right? What they actually are the primary care docs of the musculoskeletal system, right? And if you think about it that way, that's much more value-oriented and important in this direct care model when you're talking to employers. Like, we're not just surgeons. Yes, if surgery is needed to be done, we're great at it, but we do all these additional things. When HealthMe looks at like what an orthopedic group transacts on HealthMe, more than 90% of the services they transact are non-surgical, meaning that for every 10 patients that an orthopedic group sees through HealthMe, 9 of 10 of those patients are walking out of the orthopedic group cured non-surgically, right? And
wow.
Yeah, exactly. So people think bundles, they think surgeries, but when you're doing this value-based direct care model, it really is the entire spectrum of care, I think.